take your time. There's no rush at all. My name is Candace, and I'm your nurse today. You're in the recovery room right now. The surgery is all over, and you did wonderfully. Everything went exactly as planned. You are safe here. For the next little while, my entire world shrinks down to this little space right here. My only job during this time is you. My focus is on making sure that you're comfortable, that you're waking up gently, and that you're feeling okay. So just relax, let the sleepy feelings from the medicine continue to wear off at their own pace. I'm right here with you, and I'll be checking in on you every couple of minutes. Alright, there we go. I can see your eyes are fluttering a little bit. Yeah, that's a good sign. So welcome back. Let's just start with the basics for now, okay? Just to help your brain catch up with the rest of you. Can you tell me your name? That's perfect, thank you. And do you know where you are right now? Yeah, you are in the hospital, in the recovery room. The surgery is all finished. It feels a bit like waking up from a very, very deep sleep, doesn't it? Yeah, it's a little disorienting, but that is completely normal. Your body just went through a lot, so we're going to take this next part very slowly. So, first things first, I just want to know how you're feeling. On a scale from 0 to 10, with 0 being no discomfort at all, what would you give your pain level right now? Okay, so a 2 or a 3, that's not too bad at all, but we want to stay ahead of it. Discomfort is much easier to manage if we don't let it get out of hand. The doctors gave you some lovely medicine to keep you comfortable, and it's still working its magic. But if that number starts to climb, you just let me know, okay? We have something that we can give you right through your IV to make you more comfortable, okay? Yeah, we don't want you to be in any pain. And how about your tummy? Are you feeling any upset in your stomach? Sometimes the medicine that they use can make you feel a little queasy. Yeah. Okay, yeah, no nausea. That is wonderful. That's what I like to hear. If that changes at all, we do have medication for that too. So please don't hesitate to tell me if anything does change. Okay, good. So now I want you to just do one thing for me. Can you take a nice, slow, deep breath just in through your nose and out through your mouth? Beautiful. Just like that. Let's do one more. Okay, so a deep breath in. Feel your belly rise and slowly let it all out. Excellent. Taking those deep breaths is so helpful. It helps your lungs to wake back up and feel refreshed. It's the very first step to getting you back on your feet. You have a little bit of oxygen right now, just through this little tube that's sitting under your nose. It's just giving you a little extra support as your body is waking up. But your breathing is looking great. It's nice and steady. Alright, I'm going to do our first set of checks now. This is something I'll be doing pretty frequently while you're here with me. It's just to make sure that your body is waking up happily. Okay. So first, I am going to place this little clip just on your finger. It shines a little red light, but it doesn't hurt at all. Okay, it's just going to measure the oxygen in your system, and it also tells me your heart rate. Okay, let's go ahead. Perfect. Okay, so your oxygen levels are perfect, and your heart rate is lovely and calm, just resting peacefully. Yeah, that's very good. Now I'm going to check your blood pressure. Okay, I'm going to wrap this cuff around your upper arm. It might feel a little snug, but it'll only be for a moment. Okay? Alright. Here we go. I'm just going to get this all situated. So just relax your arm for me. Let it go all heavy. Perfect. Okay, you're going to feel it get tight now. Alright. Just a few more seconds. And there. All done. Okay, let's see what we have. So your blood pressure is absolutely beautiful. Your body is handling this so well. You're very peaceful. The next thing to check is your temperature. I'm just going to use this little scanner. It just kind of glides across your forehead. It's very quick, okay? temperature is perfectly normal. Okay. Okay, one last thing for this set of checks. I'm just going to check your eyes. This is my little otoscope. I'm just going to use its light to make sure that your pupils are reacting nicely as you wake up. It's not too bright, I promise. Okay, I'm just going to have you look straight ahead, okay? That's perfect. Alright, I'm just going to bring the light in from the side. Just checking this eye. Okay, that's good. Now let's go ahead and check that other eye. Just keep looking straight ahead. Okay, yeah, that is beautiful. Your pupils are reacting perfectly. That's another wonderful sign that you are waking up just as you should be. Speaking of which, are you comfortable? Are you warm enough? Yeah, we have our air conditioner set pretty high right now. I know you can hear it pop on from time to time. This blanket is fresh from the warmer, so it should keep you quite warm. Let me just tuck this in around your shoulders a little bit. Okay, and there you go. The goal here is for you to feel as cozy and as safe as possible. You have an IV in your hand right there. See? This is how we're giving you fluids to keep you hydrated until you're ready to drink something. And it's also our little helper if you need any of that pain or nausea medication that we talked about. I'm just going to check that area. Okay, I'm just looking to make sure that everything looks calm and healthy. Okay, yeah, everything is looking perfect. The little bandage is clean and secure. There are no issues at all there. You are doing so well. Just continue to rest. Your only job right now is to wake up slowly and breathe. I'm going to be right here just making some notes. Okay? If you need anything, just don't hesitate to ask. Okay? Has that comfort level changed at all? You're still feeling pretty good. Great. Excellent. So, we'll just keep everything calm and relaxed. And you still have no upset tummy? Okay, that is wonderful. You are waking up from the medicine very gracefully. Let's do those checks again, okay? It's going to become a familiar, gentle routine for us. I'm just going to place this little clip back on your finger, okay? Okay, perfect. Yeah, your oxygen is still looking great, and your heart rate is so steady and calm. It's fantastic. And now, for the blood pressure cuff again, you know the drill. Just relax that arm for me. Okay. And here's that gentle squeeze. And done. Let's see. That's still absolutely perfect. You're giving me all the calm, happy numbers that I love to see. Now I'm just going to do a quick check of your eyes again with my otoscope. You remember this from last time. So just look right here at my nose for me. Perfect. I'm just going to be checking this side. Okay. And that over to this side. Okay. That's great. And now can you follow the light for me with your eyes? Don't move your head. Okay. So we're going to go up and down, over to the side, and to the other side. Okay, excellent. Your eyes are tracking perfectly, and your pupils are nice and equal. Everything looks wonderful. Yes. Now I'm just going to take a peek at your bandage. I'm not going to take it off. Just want to look at it to make sure that everything is okay underneath. Alright. The doctor put a special bandage on in the operating room, and we like to leave it in place for a day or two to keep everything clean and protected. Okay, so I'm just going to gently lift the edge. Okay, Everything looks very peaceful underneath. That's exactly what we want to see. Okay. Alright, so now that you're waking up a little bit more, I want you to try something for me. Can you just try to wiggle your toes? Okay, perfect. Wonderful. And can you bend your knees just a little bit? And slide your feet up towards you. Excellent. Moving your legs is another really good thing to do. It helps encourage blood flow, and it feels good to stretch a little after you've been laying down for quite a while. You're doing a great job. And how does your throat feel? Sometimes after this kind of deep sleep, your throat can feel a little sore or scratchy. Yeah, it's a little bit dry. That's very common. We can't have anything to drink just yet. We need to wait until you're a little more awake to make sure that you can swallow easily. But if you're feeling up to it, I can get you some ice chips. It's just a tiny bit of water that will melt in your mouth and help with that dryness. Would you like to try that? Okay, yeah. Let me go and get you some ice. Be right back. Okay, here we are. So just let them melt on your tongue, okay? Don't try to chew it. Okay, how does that feel? Is that okay? Okay, great. That's very good. Just take it slow. And this is a good way to gently reintroduce things and make sure that your body is feeling happy. The surgeon came out and spoke with your family or the friend who was here for you. They let them know that everything went well and that you'd be resting here with me for just a little while. So no one is worried. They know that you are in good hands. Okay, you're making wonderful progress. We'll just continue this pattern for a little while longer. Okay, more rest, more deep breaths, and more gentle checks. You just focus on feeling better, okay? much more awake now. Your eyes are open and you're looking around, very alert. That is a lovely sign. How is your comfort level? Has it changed at all? Still good. Wonderful. So we've kept everything nice and calm, which is great. And the tummy? Okay. Yeah, that's fantastic. You're still feeling settled, which is perfect. Okay, so we're gonna go ahead and do our checks just one more time. Okay? We're gonna do the clip on the finger. Your body is breathing beautifully. Your heart rate is so calm and relaxed. And the blood pressure cuff is next. Okay, you're a pro at this by now. Okay, and okay, great. Everything is stable. Let's just do one last check of your eyes. You're looking so much alert now. I bet that they will be perfect. So just look at me. Okay, great. Quick check on this side. And that side. Okay, perfect. Your eyes are clear and your reactions are quick and sharp. That's exactly what I want to see. Because you're doing so well, you're awake and alert, and your comfort is well managed. We can start thinking about getting you ready to go home. Does that sound good? Okay, great. So I think that we can try some clear liquids. We usually start with something simple like water or maybe some juice or ginger ale if you prefer. Which sounds good. You want some apple juice? It's a great choice. Let me go and get that for you. Okay, one sec. Okay, and here you go. I'm just going to set that right here by your side. Just take a few small sips to start. Don't drink it all at once. Okay, let's see how your tummy likes it. It tastes good. Good. discharge instructions. This is all the information that you'll need to take care of yourself at home. Okay? I'll go through it with you, and then I'll go through it again with the person who is taking you home. Okay? So let me give this to you, and we'll go through that together. Okay? So for the first day after surgery, you'll need to have a helpful adult with you. The medicine can affect your judgment and coordination, so it's just for your safety. Okay. So for the rest of today and tonight, you are not to drive, operate any machinery, or make any big decisions. Your only job is to rest and recover. Does that all make sense? Okay, great. You finish up your juice and we will go over everything in detail. Okay. You are in the home stretch now. Okay, let you finish that. Okay. Alright, so you finished all of your juice and your tummy's still happy? Okay, wonderful. Okay, so I've got your information packet. I've given that to you. It has everything we're about to discuss written down, so don't feel like you have to memorize it all. I know you're still feeling a bit sleepy. It's perfectly normal. We'll just review it now, and your ride home will also get a copy too. Okay. So first, let's talk about staying comfortable at home. The doctor has prescribed some medication for you. It's important to take it as you need it, especially for the first couple of days. The goal is to stay ahead of any discomfort. Alright, so don't wait until the pain becomes strong before you take your medicine. The prescription has already been sent to your pharmacy, so your friend or family member can pick it up on the way home. Alright. Sometimes pain medication can make your system a little slow, so to help with this, it's really important to drink plenty of fluids like water and juice, and to eat gentle foods with fiber. Getting up and walking around a little bit every hour or two can also help a lot. You can also use other things to help with discomfort, like applying a cool pack to the area for about 15 to 20 minutes at a time. Just make sure to to protect your skin. Do you have any questions about staying comfortable? Okay. So next is caring for your incision. As we talked about, the bandage should stay on for now. Your instructions say that you can remove it in about 48 hours. When you do, you may see some small strips of tape. Just leave those alone. They will fall off on their own in about a week or two. Okay. You can shower in a day or two. Let the warm, soapy water just run over the incision, but do not scrub it. Okay. After your shower, just gently pat the area with a clean towel. Try to avoid taking a bath or going swimming until the doctor says that it's okay, which is usually after your follow-up appointment. We want to keep the incision from being submerged in water. Now, it's good to know what to look out for. You should call the doctor's office if you notice any new redness or swelling around the incision. If you see any drainage, if the discomfort suddenly gets much worse instead of better, or if you start to feel very warm with a fever, it's normal to have some discomfort and a little bit of bruising, but those specific signs should be checked out. Okay. Do you have any questions about that? Okay, good. Now let's talk about activity. For the next week or two, you need to take it easy. As I said, no driving for at least 24 hours, and absolutely not while you are taking the stronger pain medication. Sorry. You should also avoid any heavy lifting, nothing more than about 10 pounds. Okay, think about a large jug of juice as a reference point. Walking is encouraged. It's wonderful for you. Start with short, frequent walks around your house, and you can gradually increase the distance as you feel stronger. Make sure to listen to your body. If something hurts, stop. Rest is just as important as activity during your recovery. What about diet? For today, it's best to just stick with light, simple foods. Things like soup, toast, crackers, some yogurt. Your appetite might not be fully back yet, and that's okay. Alright, just start with a small amount of food and see how you tolerate it. As long as you're not feeling sick, you can gradually return to your normal diet tomorrow. Alright. And again, remember to drink plenty of fluids. Finally, you have a follow-up appointment scheduled with your surgeon. in 2 weeks. The date and time are written down on the front page of your packet. This appointment is very important so the doctor can check on your healing progress. This packet also has the phone number for the doctor's office, as well as an after-hours number. If you have any concerns that aren't an emergency, you should call that number. Okay. Of course, for any true emergency, like sudden shortness of breath, chest pain, or a lot of bleeding, you should call 911 or go to the nearest emergency room. Okay, it's very important. I know that was a lot of information to take in, but like I said, it's all written down right there for you. Do you have any questions for me at all right now? Anything that I can clarify? You feel like you understand everything? That is very good. You have been an excellent patient. You've woken up so smoothly and you're recovering beautifully. I'm just going to finalize everything in the computer, okay? And I'll have them call your ride to come to the front entrance to pick you up, okay? And while I do that, I just want to say that it has been my genuine pleasure to take care of you. My goal is always to make this part of the process feel as safe and calm as possible. Okay. Alright, I hope that you have a great rest of your day and make sure to take it easy. Okay. Oh, and your friend is on their way to the discharge lounge now. Okay. We have just one last thing to do, and that's to take out your IV. And then you'll be all set. Okay? So I'm just going to turn off the pump here. Okay. And I'm going to gently just peel back this little bandage. Okay. Just stay very still for me. Okay, you're going to feel a tiny bit of pressure on the count of 3. Going to slide the little tube out. Okay? 1, 2, and 3. Okay. Perfect. Let me get a little cotton. There. I'm just putting some pressure here. Just holding it there for a few seconds. Almost there. Okay, it looks good. I'm just going to place a small band-aid, grab one, right on So there you have it. You are officially untethered. No more tubes or wires. The transport team will be here in a moment with a wheelchair to take you down to meet your friend. You've done all of the hard work. Now you get to go home and rest and let your body heal. Okay. Remember to be kind to yourself for the next few weeks. Listen to your body, accept help from others, and give yourself the time you need to recover fully. Alright. Oh, here's your ride. It was truly a pleasure to be your nurse today. I wish you a smooth, speedy, and comfortable recovery. Take good care of yourself,